Hello and welcome to Circle of Eden, everybody. I am your host, Jenness White, and today we're going to do a quick segment on some breaking news. And what happened recently was that a doctor, Dr. James Thorpe, who is an OBGYN and maternal fetal medicine physician, he's also currently the chief of maternal and prenatal health at the Wellness Company, just testified before Congress. Some very disturbing news. But before we get into that, let me just do a little bit of a quick background on Dr. Thorpe. So during my time at His Glory, many of you know I reported the news. I also did take 5 interviews with many specialists, experts, pastors, and so forth and so on. And I was blessed to be able to recently interview Dr. James Thorpe, and he had some very disturbing news. We're actually going to show you a clip of his interview today because it ties right in with what he just testified before Congress. But to give you a little bit of background on him, he has 275 clinical research publications, 70 are COVID-19 related. And he's done a lot of work, again, in the area of maternal and fetal care. He actually has over 40 years of experience in the field, which makes him an expert, definitely. And he just had some very concerning stats. So recently, like I said, he testified before the U.S. Senate Committee on Homeland Security and Governmental Affairs and revealed that recent studies show women that were given the COVID shot during their first trimester experience an 82% miscarriage rate. All right, everybody, that's an 82% miscarriage rate. And this is truly horrific news, but I feel like it's something that I need to get out and just tell everybody about. Again, I feel like your physical health and whatever it is that you decide to do as far as going to the doctor, whether or not you take vaccines, that's totally a decision that you have to make. However, in order to make a well-informed decision, you have to have all of the facts. And so this is something, again, that was just testified before Congress. And so this is information everybody needs to know. So per the Western Journal, he also revealed this miscarriage rate mirrored the effects of various abortion drugs designed explicitly to kill unborn babies. And so that was something different. I hadn't heard that. So again, a lot of people are doing studies now on the COVID shot because people are experiencing some side effects. And because it was experimental, people didn't know exactly what was going to happen, but more and more information is coming out with Dr. James Thorpe just in his area, maternal and fetal care has come out with this, again, these staggering statistics on miscarriage rates. And so Dr. Thorpe referenced a New England Journal of Medicine op-ed that was co-written by then CDC Director Dr. Rochelle Walensky in 2021. 2 years before she resigned, she wrote this op-ed. And he said that she sought to coerce pregnant women into taking the shot despite the risks. And according to Dr. Thorpe, pregnant women were deliberately targeted because they are the primary decision makers in healthcare across the human lifespan and because they are the most vulnerable patients. And he explained, quote, if they could be convinced that the shot was safe and effective, it would imply that it was safe and effective for everyone. He went on to say that they made statements that were fear-mongering, insinuating that pregnant women, if they didn't take the shot, would put their lives in harm, their preborn lives in harm, and their newborn lives in harm. And he says they absolutely knew the opposite was true. And again, I'm quoting him from what he testified to per the Western Journal. And so this is very disturbing. And I just wanted to put this information out here. He also cited another study that had come out during COVID that showed the COVID shot was the deadliest and most injurious shot ever released. And so what I wanted to do, everybody, since I recently was able to interview him on His Glory TV, and again, that's hisglory.me is where you can find this full interview, but I want to show you this clip because I think that it's very important to hear him. And again, he is an expert on maternal fetal care. Here is a clip of our recent interview.
The most egregious population were my patients globally: pregnant women, preborn, and newborns. And Jen, it was a bloody disaster.
Well,
Can you tell us, and it's so sad, and I know more and more research is pouring out, which you've been saying this from the beginning, that this has been happening. And I know we've seen an uptick in miscarriages. We've seen, all of this data now pouring out. And so what are the stats, doctor? What can you tell us? How bad is this ultimately going to be when all those numbers come in and people start diving into this more?
Well, we don't know how bad it's going to be. And that's the problem with the vaccine. And that's what I was screaming about in 2020. We need to do appropriate randomized double-blinded placebo-controlled trials, which the stakeholders refused to do because they knew it was deadly. Listen, this was a deadly experiment in animal research, okay? The mRNA technology was used in animals, 10 years ago. It was deadly. So what has transpired has been an absolute catastrophe. There are now data showing that fertility rates are down 66%. 66% in age, women of reproductive age in many countries.
Was this, doctor, I'm sorry to interrupt, but was this women who took the COVID shot? Because I know there's also something called vaccine shedding, or is this impacting everybody at this point?
That's a terrific question. This is actually vaccinated women, and this was recently reported by Steve Kirsch on his X and his publication, Substack. He's the head of the Vaccine Research Foundation, as you know. He recently reported that, and I vetted that data. But to your point, excellent point, Jen, and that is that we've published now 2 articles suggesting that, unfortunately, this so-called shedding event is real, and our publication, which has been published in the last 3 months, I think is the first publication that scientifically documents. All of us knew that it was occurring. Listen, the drug companies, before it was rolled out, said, do not have any exposure with pregnant women, use 2 condoms, if you choose to be intimate. They knew, but they told their participants in their clinical trials, but they didn't tell anybody else. They kept it secret from everybody else. So the shedding event is real. What is being shed? We don't know. Is it the spike protein? Is it the lipid nanoparticle? Or is it the mRNA repackaged as exosomes? We don't know that. And there's no funding and no interest and no it's totally shut down all the monies for research from that traditionally have come from pharmaceutical companies and the government. This shedding phenomena is real. Our recent publication showed that of those women of reproductive age that never had COVID, never had the vaccine, never had a positive test for COVID, a large proportion of those women experienced severe menstrual abnormalities when they came within 6 feet of a recently vaccinated individual. So, and that's just menstrual shedding. Can the same thing occur with cancers, with myocarditis, with autoimmune disease, with stroke, with blood clot? Very probable. We don't know. There's no funding for appropriate research because that research is contrary to the lethal narrative that our government has been off the rails, Jen. There's been no checks and balances. It's a corporate kleptocratic triangle between the government, the pharmaceutical companies, the medical journals, and the major medical circles that are in on the take. Listen, vaccines reap $60 billion of profit annually.
All right, everybody. So, this is some disturbing stats and studies that are coming out about this COVID shot. And people like Dr. James Thorpe are trying to blow the whistle. And that's why I wanted to report on this today. Again, thank goodness this information is now going before President Trump and other people. And hopefully, I'm waiting for the day that President Trump responds to all of this. But the fact of the matter is, at least Dr. Thorpe was able to testify here recently to these studies and what it is that he's seeing. And before we get into more about Dr. Thorpe, I just want to tell everybody, because I think that it's extremely important during this time to remember something. So as I'm giving you this type of information, and I know it can be very scary, but remember what scripture says for God's people. We all know somebody who took this shot. I know a lot of people now who wish they hadn't taken it. However, I always tell them, and I'm going to tell you guys, that, God did not give us a spirit of fear, but of power, love, and sound mind. And he is the great Jehovah Rapha. He is the great healer. And so, we need to prayerfully take this up with God, but we also need to pay attention to what is coming out. I truly feel that God raises up people for such a time as this, people like Dr. Thorpe, who he has nothing to gain in any of this by releasing this information. He's not getting money from it. If anything, he's been attacked because of putting out this information and because of his studies, because it doesn't fit the narrative, yet he does it anyway. And he's a very strong Christian and strong in his faith, and he's blowing the whistle on this. He's one of many. And so again, he has nothing to gain, everything to lose, as far as if you look in the physical, from just releasing this information, yet he's doing it anyway. So thank God for that. But I also feel this information needs to come out so that everybody can make an informed decision about whether or not you take this shot, continue to get boosters, whatever the case may be. This needs to come out. And as he said, there's not a lot of studies about this, and there needs to be. And because of the research that has come out, in my opinion, it should be stopped until they can get all this research. And anyway, but regardless, I'm not an expert in the medical field, but what I am is somebody who tries to get to the bottom of this and truly do reporting and investigating into the heart of some of these issues that are coming to the forefront right now, like this COVID shot, and how it can be detrimental to health. And so I wanted to show you that clip, especially since, again, he just recently testified before Congress. And just to go into a couple more things, Dr. Thorpe, if you're interested in this, you want to know more, he has a book called Sacrifice: How the Deadliest Vaccine in History Targeted the Most Vulnerable. That just came out in February. And so you might want to consider educating yourself on that as well. And so again, that Sacrifice: How the Deadliest Vaccine in History Targeted the Most Vulnerable. And he co-authored this book, but he goes into some of the details as to why he formulated the conclusions he did and the data backing it up. And so I think, again, during this time, it's important to educate ourselves and also to pray and take it up with God when it comes to important things like health decisions, especially for our children. And this is very concerning, especially the parallel with the miscarriage rates. And I don't know about you guys, but I know tons of people, it seems like I know a lot that are miscarrying. And I myself miscarried last year. Now, I didn't get the COVID shot. And I don't know if all my friends, the ones that I know that did miscarriage, I know several of them did not. I know some that did. And so again, he's saying there is a correlation between, miscarriage rates and there's also some weird menstrual things going on with women who were within a vicinity, he said, of people who had just recently had the COVID shot. And so we don't know what impacts this means, what this is going to have for the future as far as, the effects that this is going to continue to have. But what we do know is there is a huge problem. And it seems like it's the elephant in the room. A lot of people are ignoring it. It is starting to come out. But still, again, my prayer is that, this information gets to President Trump. And, I know RFK Jr. has mentioned that he's looking into this as well. Of course, the new director of HHS. So hopefully, again, this comes to the forefront and we can get some more research out of this and get some more information. But I just wanted to share what we do know. And then again, you decide what you think And I would encourage everybody to get this book. Also, Dr. Thorpe is not making any money off of this book. All proceeds go to the victims of the COVID shot. So people who developed issues shortly after getting it, all the proceeds from this book go to them. He also stated during the rest of our interview, and for that full interview, everybody, again, that was on His Glory TV. So you can go to hisglory.me to watch the full interview with Dr. Thorpe, or you can go to Rumble, His Glory TV, and click on Take 5, Dr. James Thorpe to get the full interview. It was a full 30 minutes. That was just a quick 5-minute clip. He goes into a lot more information, such as he stated that he was observing that almost nobody as of February that came to his office had taken any boosters, or if they were new patients coming in from maternal fetal care that were newly pregnant, they were for the most part stating they had decided not to get the COVID shot. So some of this information, obviously his conclusion was that some of this information has gotten out and people are making informed decisions of not getting it based on what they've learned from the studies. And again, I'm just, as a disclaimer, I am not an expert in the medical field, but what I am is an investigative reporter. And so I just want to get out the information and share this information. And then you make a decision about your own health. And again, you can ask your doctor some of what you're hearing and see what they say. But again, some of the doctors don't know anything about this, or, as he mentioned, he called out big pharma that are making a lot of money off of this stuff. And so a lot of this, the people that speak out against it are getting shut down, blacklisted, shadow banned. Their videos are being taken down because they're speaking out. And so, but again, you're responsible for your own health decisions, but we're just trying to give you more information so that you can make a well-rounded decision based upon what we do know in some of these new studies coming out. So that was it for today, everybody. I did want to end today, again, back to the scripture about not having a spirit of fear. And I think in situations like this, sometimes you tend to panic when you hear these studies and things like this. But again, we take it up with God through prayer. And also, there's a lot of great people that God is raising up from the Wellness Center, which is where Dr. James Thorpe is, but also other places that have a great regiment for any injuries that come from this, and natural remedies like vitamins and spike protein detoxes and all of this stuff that you can research and make an informed decision about. And if you feel like you need to, go ahead and get those things to cleanse your body of some of this. And Dr. Peter McCullough is another one who does a phenomenal job of getting out information of some supplements and different things and some detoxes that you can take. And so I do feel like, there is light at the end of the tunnel with this, but we also need to be, in the know and pay attention to these statistics, because that high of a percentage rate of miscarriages is not normal and something needs to be done. And so what you can do right now is hit subscribe, like, and share this video, and share it with people you know. And then again, let them decide. All we are is getting out the information. I'm not trying to force my opinion on anybody, but I do think that this information needs to get out. And so we hope this segment blesses you. We thank you. And until next time, we'll see you back on Circle of Eden.